everyone. Thank you so much for joining me for this COVID-19 therapeutic recovery class. It's worth mentioning that this class is entirely suitable for any chronic illness recovery or a gentle reintroduction to movement. We're going to be taking it really nice and slow and honouring what our body really needs, and I really like to make a point of that. We're not trying to stretch or strain or exert here, and more than ever during illness recovery, we need to be really mindful about what our body needs and what things really feel like and whether they're helpful or not. So if at any point your body, it doesn't necessarily have to be screaming, I don't like this. It might just be a gentle niggle, I'm not sure about this, and I'd rather we didn't do that. Listen to it, please. Please listen and feel empowered to come out or try something else. Now, it's really worth mentioning that people's experience of COVID-19 is vastly different. We have the whole array, a whole range of symptomology, right from no symptoms, no issues, through to highly debilitating and difficult to manage chronic fatigue, chronic pain, chronic long COVID, and in between, everything in the middle. So it's difficult to tailor a class to specific symptomology. However, we can almost rise above the specifics of the symptoms and provide something that's genuinely very healing. And we can do that by helping to guide the body into the parasympathetic response. So when we're stressed and anxious, when we're ill, we spend time in the sympathetic response, which is an active, fraught, doing part of the nervous system. And actually what we're trying to do is to relax it and guide it into a place where we can repair and restore. So that's what we'll be doing during this practice today. So we're going to be very kind to ourselves and really listen to what the body needs, first off. Second, we're going to appreciate that even if we can't do all of these movements or they aren't suiting us right now, that doesn't mean that the practice is wasted or that you're not where you should be. So part of being kind to ourselves isn't only stepping away from unhelpful physical sensations, it's also being mindful of those unhelpful thoughts. And this is particularly relevant for those of us that are used to perhaps a more exertional physical asana practice, where you feel like you really should be able to do this by now, or you have any sort of unkind thoughts towards going gentler or slower. Please let them go. They're not helpful, they're not correct actually. Gentle, slower practice isn't less valid or a watered down version. It's equally helpful and relevant and important. So please just embrace it for the practice it is. Whatever practice comes to greet you today, that's okay. We're forever changing. So just be mindful of those 2 points. And the other thing is, whilst particularly if we're suffering from long COVID and we're feeling very helpless and stagnant and stuck in symptoms that we can't shift, not just for COVID, but perhaps other longer term chronic illnesses as well. Whilst yoga might not be able to heal us, it can certainly help us. And even if you show up, even if it's just logging on and having the video play while you don't do anything, you've still shown up. And it's still important and it's still done something, and you might find that over time you can do a little bit more and a little bit more, and with that something shifts for the positive. Okay, so you can see that with me I've got an array of restorative yoga props. So I've got 2 bolsters, 4 4 blocks, a blanket and 2 flat blocks. Now you don't have to have specialist yoga equipment. There's plenty of ways we can use things around the house. So if you don't have them with you now, I'd encourage you to go and grab a few pillows. It's really easy actually to make a makeshift bolster using a duvet and pillowcase. So you can take a double duvet, fold it in half along its long axis, and then roll it up and pop it in a pillowcase, and that makes a fabulous soft bolster. Blocks, not always, but sometimes, depending on how we're using them, can be really easily substituted for things like books. And I'm sure you have plenty of blankets at home. Strap, may not need today, depending on how you're feeling. A dressing gown strap or belt is fine. You can see that I'm practicing on carpet. I've certainly found that my body's a little bit sensitive in recovery, and the softness below the mat really helps to support me to find that comfort. So we're going to begin first of all with a check-in. So I'm going to close my eyes, and if you feel comfortable, please be invited to do the same. If not, just fix a soft gaze at some point ahead of you. Settling into our comfortable seated position, and it may be that you want to participate with this practice in a chair. That's absolutely fine. You can see that I'm in easy cross-legs pose. It may also be that you'd like some support behind your back if you're feeling particularly tired or achy today. So, settling in, finding the rhythm of our breath, noticing where the inhale comes to greet us. Are we feeling it in our nostrils, in the back of our throat, in the top of our chest or across our collarbones? Or deep down with the diaphragm? Noticing without judgment and asking ourselves how we feel today. Do we need to make any adjustments in our physical posture? Perhaps easy cross-legs pose doesn't suit you and you'd like to stretch the legs out. Just take this time to make any adjustments your body's asking for. Checking in also with our mental thoughts. Is there anything arising? We're not trying to unpack or analyze any thoughts. We're just noticing them. Appreciating that they're separate from us. And if we need visualising packing them away in a little suitcase and placing them down at the side of the mat. We don't need them right now. Perhaps lowering the head down, chin towards the chest. If there's any muscle tension or soreness in the backs of the neck or the shoulders, if you want to support the head in this downward motion, that's absolutely fine. Before blinking the eyes open if they were closed and returning to neutral. So we're going to begin with our seated postures. There's no standing at all today, and that's particularly helpful if we're struggling with any dizziness or orthostatic hypertension. So that's when we move from lying or sitting to standing. We struggle with our blood pressure lowering, and that can make us feel dizzy or that we need to faint. We're staying on the floor today. Now I'm going to take my seated postures in easy cross-legs pose, and you can see behind me that I've got a little meditation cushion. A normal cushion will do, or you can sit flat on the mat. The choice is yours. And I'm just going to fold my legs in. Now for some people, cross-legs isn't comfortable. As I said earlier, you're welcome to be seated in a chair here. There's no need for you to be folded in cross-legs. It's not adding anything. Another alternative is Virasana, so hero pose, which can be really nice to take straddled on a bolster. And if you have any issues with hip flexion, perhaps you've had knee replacement or you've got joint pain, then you can raise the bolster height either by placing a second bolster or adding other props under, so that the angle of flexion of the knee is reduced. So I'll just demonstrate that. And if there's any joint pain there, it can be really helpful to make sure that the ankles and the tops of the feet are padded, because when we're in discomfort, it detracts from our ability to be able to access the parasympathetic response, so we're not able to rest as effectively. So take your option, take your choices. As I said, I'm going to take cross legs, Sukhasana. It's often translated to easy cross legs. It's not easy. There we go. So I'm being mindful of the cross of my legs, so my right leg is out front, because I'm going to change that cross when we come to move in a moment. So settling in here. And I'm going to begin by using my inhale to stack my spine nice and tall. And on my exhale, I'm just going to turn my head to the right hand side. Inhaling back to center. Then when my next exhale comes, turning to the left. Waiting for the inhale. And letting the inhale guide me back to center. Exhaling to the side. And again, if you've got any neck or shoulder pain, please be gentle. Don't try to push through anything. Just take it as far this feels comfortable, and that may just be only slightly off center. We don't have to be looking all the way over our shoulder. Here is absolutely fine. One more on the left hand side. And back to center. And from here I'm just going to let my left ear move towards my shoulder. So my shoulder's not coming up to my ear's coming down to my shoulder. And I might wish to just place a hand on the side of my head to draw that down. And you can also use the free hand, so in our case the left hand, to massage the neck and shoulder. If you've got any tension or tightness there, it can be really nice to just check in with a touch and self-massage. Inhaling back to center before exhaling to the other side. Massaging down side of the neck and into the big body of the trapezius muscle, which often carries lots of tension and discomfort. Inhaling back to center. Now, we're just gonna use that inhale to draw the right arm over, extending in a side bend towards the left. We're not trying to push or force or stretch. We're just letting ourselves find some space and openness in the side body. All the way across here. So I'm keeping my spine nice and tall, but inviting a bend there. Inhaling back to center. So the inhale comes to bring our arm up, and then with the exhale, we move into that lateral side bend. Inhaling back up and releasing. Just one more on either side. Inhaling, left arm comes up. Exhale, we take that side bend. Inhale to come back up. Alright. Just going to take a couple more arm movements before we change the cross of our legs. So I'm going to raise both arms on my inhale and give myself a nice hug. So you can see my right arm's coming over my left. It doesn't matter which way around you take it, we're going to alternate. So this is a variation of eagle arms, where we've wrapped our arms around ourselves and given ourselves a hug. And sometimes it can be really nice to just turn from side to side, or sway and appreciate the physical contact of the hug. From here, we're going to inhale to open the arms nice and wide, and perhaps invite a little bit of extension into the spine here. If there's any dizziness, just keep the head neutral. Arms come back down, and we can change the cross this time. Inhale, arms come out and into cactus. Perhaps you want to use an extra inhale here to really lengthen and lift the spine before exhaling back into a hug. One more of those. Letting the inhale guide and support the movement. Taking it only as far as the inhale is. I'm going to take an extra breath in here to lengthen and lift my spine in extension before exhaling and changing the cross so that the left arm's on top of this final one. And here I'm going to lower my chin down, stretching into the back of my neck before inhaling to release. And here's a nice point if you are in cross legs to change the cross. You might wish to put the legs out straight, give them a little shake or wobble, ask them what they'd like, what they need, and then change that cross round. So I had my right leg up front. That's my preferred side. Something it's useful to be mindful of. So left leg's in front this time. And we're going to take some gentle twists. Really gentle. So we're inhaling. Using that breath right from the base of the lungs, almost as if it grows as taller, to really lift the spine. And then on our exhale, we're just going to turn, taking the left hand to the right knee. So there's no cranking or turning or forcing, just a gentle twist with the chest facing towards or somewhere towards that leg. And again, head can stay neutral, or you might wish to take it over your shoulder depending on how you're feeling. Inhaling to release, maybe taking an extra breath here, slow and steady, before exhaling to the other side. And the two sides might feel very different, very stiff, very sore. Be kind and gentle with yourself. Inhale back to center. Next, we're just gonna place our arms behind us. So if we're on the floor, that's directly on the floor. If we're on a prop, it might be that the arms are on the edge of a prop. Similarly, if we're on a chair, we might just want to shuffle a bit further forward and put our arms towards the back two corners of the seat. So I'm supporting my body with my hands behind my back on the floor. And I'm just going to breathe into a spinal extension here. And the arms don't have to be straight, it doesn't have to be anything spectacular. I'll show you this angle so you can see. They're just placed here. And I'm just inviting some extension here. Again, it's useful often for the head to stay neutral if there's any dizziness. We certainly don't want to be throwing our head back. And exhaling to release. And from here, we're just going to do that twice. And on this go, as we exhale to release, we're just going to come down over the right knee. So a similar position to when we were just in our twist. We're coming down, stretching the side body into a forwards fold. Now if there's nasal and sinus congestion, forward folding can be really challenging. So don't worry if that's not suiting you. It may be that you can only transition there very briefly. It may be that you don't want to go there at all. No problem. It's possible to still forwards fold and keep the head up. If there's no problems with the neck, feel free to take it like that, particularly if you're struggling with that congestion and pressure in the head and sinuses. One more of those spinal extensions. Inhaling, lengthening and lifting across these collarbones as if they were smiling. Letting that breath guide the movement, so we're not forcing the back into anything. We're just lifting and blossoming as if the breath starts here. It does start here. And blossoming into the shoulders and up. And then exhaling this time to fold over the left knee. Again, being mindful if there's any congestion. You don't have to go all the way down, you don't have to stay down. You can still fold like this. Coming back up. Lovely. So we've taken our neck and our back through all the range of spinal motion. We've done extension and flexion, lateral flexion and rotation. And we're going to just move into lying postures now. So supine postures. So I've planned 3 restorative postures for us to go through that should hopefully be helpful. From my personal experience of COVID-19 in particular, I've certainly found sinus pressure and congestion and dizziness to be an issue. And for that reason, the supine postures, even though they are lay on a mat, I have chosen to elevate the torso at 45 degrees just to try and counter that, because I find, again, this is my personal experience, it's absolutely fine if you would like to be flat. I find that from going from lying to upright can really trigger that dizziness, and being laid down really doesn't help with the congestion. Or when I'm congested, I'm not feeling very peaceful or restful, and so it's counterproductive and counterintuitive. So this is where we're going to need some of our props. And you remember I said at the beginning, you don't have to have the official props. You can use things around the house, makeshift things work absolutely fine. So first of all, we're going to do Supta Baddha Konasana, which is reclined bound angle pose. Some of you may know of it as cobbler's pose, and the leg position is like this, with the legs taken out to the side, the soles of the feet together. So I'll show you how to set up for a restorative version. Again, as I said, I've chosen to do mine at 45 degrees. If you would like to be flat, that's absolutely fine, but I'd encourage you to explore the 45 degrees. And there's a couple of ways you can do this. I appreciate that not all of us will have 2 bolsters, but to create the 45 degree angle, we can do cross bolsters with a blanket pillow. So you'll see when I come to lie back, take my legs out, I'm lying back. So the base of my spine is at the bottom of my bolster, and the pillow supports my head in a relatively upright manner to prevent that congestion from becoming too much of a problem for me. And under my legs, I'm going to support with cushions or soft blocks. We're not trying to stretch or strain or open the inner groin, so we're supporting in a position of comfort here. Alternatively, if you don't have 2 bolsters, another way of creating that angle is, of course, to just pop pillows under the bolster, or you can try like this with the short edge. So the short edge of the block at the furthest point upright, and then the long edge of the block, and that also supports at 45 degrees, which is another perfectly acceptable option. I'm just going to put that to one side. So once you've set yourself up, we're just gonna, we just need one block on either side. Taking the feet, soles of the feet together, opening the legs out wide, not forgetting my pillow. And coming back to rest. Taking the time to make any adjustments that you need. Often it can take us a moment to find which head position works best for us, adjusting the pillow and also getting the support under the legs right. If you're using blocks, just be careful that they're not digging in or causing any discomfort and they're at the right height for you. We're just going to settle in here for a few moments. Remember always that you're welcome to stay for longer. You can always pause and extend your stay here, particularly if it's feeling helpful or like what you need today. And I've closed my eyelids again. You might wish to do so, or you might wish to just soften your gaze. Perhaps casting your mind back to the beginning of class when we did our check-in. How are things feeling now? Trying to guide the awareness towards the breath, accepting that the mind has a tendency to wander, and just gently drawing it back if that's the case. Just taking these last few minutes here perhaps to appreciate, particularly if there's elevation on the bolster, the openness and expansion across the front of the chest and shoulders. Perhaps particularly if we've had shortness of breath, we can appreciate all the space we've created here to draw the breath in. And maybe with our exhale, noticing the support of the prop underneath us and its ability to hold us, with our exhale releasing into that, trusting it can support and hold us. Perhaps inviting some deeper breaths as we signal to the body it's time to move. Blinking the eyes open if they were closed, and using our hands rather than the pure exertion of the leg muscles, using our hands and arms to guide the legs back together, just to minimize the effort that's required there. Now it may be that you wish to stay down with your torso supported. You don't necessarily have to come up to change into the next posture. We're going to move into a supported twist. So I'm just going to take either one of my feet to the outside edges of my mat, and from here just let my knees come down. Noticing where they fall and supporting them. So they're not hanging in space, they're fully supported by the props underneath them. And actually blocks aren't the ideal thing necessarily for this. You might appreciate something softer like a cushion or bolster. We're not going to be here too long. And it may be you prefer to be flat for this. Feel free to clear the props under the torso away and move flat if you feel that would work better. If, like me, the congestion and sinus pressure and the dizziness can be an issue, then feel free to stay like this. You might wish to explore changing the way the knees are bent. They don't have to stay exactly as they've fallen. You might wish to draw them closer up, straighten the legs out. All we've done is draw the body into a gentle twist. So you can see, because I've come over to the right hand side, my left hip has left the floor and the lower portion of my spine, my lumbar region, is in a twist. And after a couple of minutes there, we're just simply going to change sides. And it may be that you need a different prop on this side because it feels different. That's totally normal. Sides don't have to be the same. For me, this side is easier. Feeling very stiff on that other side today. Just letting them fall into a gentle twist. If you are still on the bolster, perhaps tuning back into that spaciousness across the front of the body and upper chest. Taking some nice deep breaths here, filling that whole space, appreciating that the lungs are from right the way down at the tips here, all the way up to their apices under the collarbones. They're huge structures. Noticing when we breathe in deeply, how that feels against the prop in the back body. And as we exhale, releasing into comfort and relaxation. And when we're ready, using our inhale and perhaps our hands as well to guide the legs back up before coming into our Shavasana. Lots of choices for Shavasana. We don't have to be lay flat supine on the floor. We don't even have to be on our backs. It's perfectly fine to be on our sides. So I'm going to demonstrate a couple of options for us. If, again, congestion, dizziness, sinus pressure is an issue, feel free to stay elevated. I'm just going to add an option in here for some height under the legs as well. So whether you're elevated or flat, you might wish to explore, I like to call this variation Stonehenge variation. You can see why. It's 2 blocks under the bolster, and it's just for my legs to go on like this. And you might need to explore what feels best for your legs as to where the bolster is. So you can see there it's supporting under my Achilles tendon, and my heels are on the bolster. That might not feel that nice for you. It might be that you like the flesh of the calf muscle on the bolster. It might be that you like it in the joint. Just see what works for you. And from here, of course, we can lie back. Just be mindful, particularly if we've got both ends of us elevated, that can sometimes put extra pressure on the sacrum, and if you need padding under there, then just grab an extra pillow. A couple of other options. Move that along. So we can take side lying Shavasana, and I'm going to use my blanket over my blocks, straddling my bolster. The reason for the block is just to create enough height for my arm to nicely fit without being squashed. It might be actually that we need even more height than that. Let's try 2 blocks there. So I've got plenty of space. That's a little bit too high. So I'm still trying to keep my neck nice and neutral. Let's try 1 block and a folded blanket. And you know, with restorative yoga, it's always an exploration. We're all so different with so much natural variation. You know, you really should feel empowered to do what works for you. So I've managed to keep my head, my neck nice and neutral here. There's room for my arm that we've created with the block. And I'm just going to draw my bolster up to where it feels comfortable. And if I had an extra blanket or I was feeling cold, I might wish to cover myself up. So this is side lying Shavasana, and it's one of my favourites. Not ideal, of course, if we've got congestion, but it's an option for you there. However you're choosing to practice, take a moment to settle in, grab the props you need. If you want the woolly socks, get the woolly socks. If you want a jumper, get a jumper. If you need a drink before you want to settle, get a drink, that's fine. Closing the eyes if that feels safe and comfortable. Softening the gaze if not. Checking in one last time with how we feel before we descend into deep relaxation, compared to the beginning and the middle of class when we asked ourselves those questions. Tuning in to the support of the props beneath us and the mat beneath them and the floor beneath them and the earth beneath that. Releasing the weight, not just our physical weight, but any emotional, mental, energetic weight that we're carrying, just that the earth can hold it and set it down. And when we're recovering from illness, there can be a lot of frustration, even anger with our bodies, particularly if they're not meeting the expectations we've set for them in their healing journey. So perhaps if we have any unhelpful thoughts or ideas around healing and how things should be going, we're going to take this moment now to set them down and instead flood our bodies with a feeling of gratitude. Thanks for our practice today. Thanks for showing up. Thanks for doing your best. Thanks for carrying me. Thanks for being my vessel during my time on this earth. I appreciate you. And I'm sorry I can be unkind when I'm annoyed I'm not well. Letting the breath carry us off into relaxation. Releasing the forehead skin, the skin around the eyes, perhaps swallowing to release the root of the tongue. Particularly if we're on our backs, letting the shoulders move away from the ears. Using every exhale to see if we can release that little bit more deeply. It's amazing how much unconscious tension we can carry, often around the neck and shoulders, but many other places too. If you're on your side and you notice that it's actually taking quite a lot of effort to stay on your side, then you might wish to prop yourself against a wall, just shuffle backwards, or draw the top knee further forwards. As that tends to help settle a little more easily. Finding your position of ease and comfort. Basking in that sentiment of loving kindness and enjoying these next few moments without my intrusion. Giving yourself as long as you need to here. Feel free to pause and catch us later. And if we're ready to finish our practice, we're going to take some nice, deep, gentle breaths. Again, signaling to the body it's time to move. And it may be that with the breath, you want to send it to the fingers and toes, inviting some movement there. Stretching and moving in whatever way feels comfortable. There's no right or wrong way to do this, except of course listening to what you need and what's right for you. Keeping the eyes closed if you can, and if they were closed to start with. If you're on your back or elevated, turning to the side. If you're already on your side, perhaps moving the bolster from between the legs so that you're free to come up in your own time, very slowly, particularly if there's dizziness, and meet me in a seated position of comfort. You may wish to join me in bringing your hands together in Anjali Mudra. So the little finger borders and the fingertips come together, and in the space of the palms, the thumbs rest, and we bring the base of the thumbs to the bottom of our sternum. Thank you for sharing that practice with me. I hope you found it useful. Please let me know, and I hope to see you again for a practice really very soon. If you're on your healing journey, I wish you so much rest and recovery, and the patience and kindness to really listen to what you need. Thank you, everyone.